What does AMH test means? AMH means anti-Mullerian hormone test. So this is basically a blood test that evaluates how many eggs are actually remaining in your ovary. This also is known as the fixed ovarian reserve. Does AMH test tell about the quality of my eggs? You must remember that this test does not tell anything about the quality of your eggs. The quality of your eggs will mainly depend upon your age and cannot be evaluated until and unless the eggs are actually taken out of your body and they are fertilized and the attempts are made of fertilization. Every woman experiences a natural decline in the AMH over the period of time. Therefore, your AMH levels need to be interpreted in comparison to your age group only. What are the AMH levels at the time of menopause? Well, at the time of menopause, the AMH levels, if you get a test done, they will be undetectable. Does AMH tell me anything about my chances of becoming pregnant right now? No, the AMH test does not provide any information about the woman's chance to conceive at the present moment. This depends upon so many other factors like the quality of your eggs, your partner's sperms, the condition of your fallopian tubes, whether they are blocked or whether there are some adhesions or it is hydrocephalus. A lot of tubal factors also contribute to infertility, and whether you are ovulating at this point of time. And I must clarify that AMH alone cannot predict anything about the fertility. The natural conception might occur even in a woman who has reduced AMH levels. Ovulation is actually a crucial factor in the natural pregnancy. If you have regular cycles, your success of pregnancy will correlate to your age and not with your AMH levels. Your age is most reliable fertility predictor regardless of your AMH levels. What does low AMH level mean? Low AMH levels might suggest that you have only a very short period left for yourself to become pregnant, and so you must seek the help of your doctor. I have low AMH, does it mean that I am infertile? No, as long as you have regular periods, you will ovulate one egg every month. You will actually have same pregnancy rates as any woman with high AMH in the same age group. The reason is that regardless of the AMH level, the women's ovary will mature and ovulate one egg per month. Overall, the number of eggs in your ovary will not affect this. So if you plan to delay your fertility, you must consider that egg freezing process or embryo freezing, whichever suits you. Anyhow, if you have been diagnosed as having low AMH, you must consult your gynecologist. I was found to have high AMH levels. Does it mean I am super fertile? This is not true. High AMH does not mean you are super fertile. You can ovulate one egg every month like any other woman. In some cases, you actually might experience irregular periods associated with high AMH. We find higher than average AMH in women who have PCOS. So in these cases, your cycles may be irregular. In fact, you will have less chances of conceiving as compared to a woman who has lower AMH than you. What can I do to increase my AMH levels? Well, the AMH levels is just a reflection of the number of eggs in your ovary. There are no medications and no medical company can claim that they can increase the AMH level. Increasing your AMH level does not actually increase your eggs in the ovary. Since your eggs multiply in your ovary only before your birth, and there is a fixed ovarian reserve. And why we call fixed ovarian reserve? That is, when they are whatever are present at the time of birth, you can only utilize them during your reproductive periods. Suppose you have 100 eggs at the time of birth, you can utilize those 100 eggs, one egg per month during your reproductive days. But if you have to utilize PCOS, so more number of eggs will be released per month, maybe 10 to 12 per month, but they would be immature and they would be the release is arrested, so they all get wasted. So high AMH is not a good indicator. The normal levels should be considered.